Hey, my name is Jennifer Avens, and I am a nurse practitioner student at Auburn University. Today I'm going to educate you on the adrenergic drug class. Adrenergics are also called sympathomimetics. Sympathomimetics stimulate the sympathetic nervous system. This is your fight or flight system. Adrenergic drugs are used to treat a variety of life-threatening issues such as cardiac arrest, heart failure, shock, hypertension, hypotension, and asthma. They're also used for nasal congestion, premature labor contractions, and eye dilation during an eye exam. There are four main adrenergic receptors throughout our bodies: alpha 1, alpha 2, beta 1, and beta 2. Each receptor plays a unique role in the way our bodies respond to a stressor. Adrenergic drugs include phenylephrine, epinephrine, dobutamine, dopamine, methyledopa, ephedrine, pseudoephedrine, Afrin, clonidine, isoproterenol, terbutaline, Xopenex, albuterol, and salmeterol. These drugs stimulate the receptors throughout your body to release epinephrine and norepinephrine, or mimic their action with vasoconstriction or vasodilation, smooth muscle contraction or relaxation, increasing calcium in the cardiac muscle, which in turn increases contractility, and bronchodilation. Adrenergic drugs are absorbed in the intestines, metabolized in the liver, and excreted by the kidneys. If a patient has kidney dysfunction, these medications should only be given in emergent situations. It is also important to know that epinephrine, dopamine, and norepinephrine are not receptor specific. In other words, they are not selective. So you would want to monitor the patient for reactions that are not therapeutic to their current issue. Because there are receptor-specific drugs, it is important to make sure you are giving the appropriate drug. For example, for nasal congestion, you would want to give an alpha-1 specific drug like phenylephrine. For hypertension, an alpha-2 specific drug like clonidine. The alpha receptors are located in the arteries. For cardiac arrest, shock, and heart failure, you would give a beta-1 specific drug like dobutamine. These receptors are located in the heart. And for asthma, you would want to give a beta-2 specific drug like albuterol. Those receptors are located in the bronchioles. The desired effects of these drugs are to increase or decrease blood pressure, increase or decrease heart rate, decrease hot flashes associated with menopause, open the airways, stop bleeding, stop contractions, and promote nasal decongestion. Some contraindications and drug interactions for the alpha-1 is hypertension, bradycardia, and prostatic hyperplasia. For alpha-2, hypotension, beta blockers, diuretics, and concurrent hypertensive use. Beta-1, arrhythmias, oxytocic drugs, linoxidil, and beta-2 is hypokalemia. Do not give these medications with MAOIs or tricyclic antidepressants, and you want to use caution in impaired liver function and renal impairment. Some adverse drug reactions to monitor for in the hospital and educate your patient on are anaphylaxis, shortness of breath, undesired changes in heart rate, blood pressure and heart rhythm like PVCs and rebound hypertension, dry mouth, sedation, anxiety, headache, angina, and loss of libido. Patient education you would give in the primary care setting include: you would instruct your patient to take clonidine at night due to its drowsiness effect. You want to take your bronchodilators as prescribed. Make sure to prime the inhaler prior to initial use and instruct them to rinse their mouth out after every use. Afrin should be used for no more than 3 days because of its addictive quality. Phenylephrine should not be used in the first trimester of pregnancy. Some lifestyle management for asthma patients would be to avoid environmental triggers if at all possible, and to pre-medicate prior to exercise with 2 puffs of their inhaler, but no more than 12 inhalations in 24 hours.